Over the past few years, I've continued to share insights into the science as to what's going on and why I predict what is going to happen next. So, if you're listening, we are going ahead of the science and predicting based on extrapolations. So, some people don't like that, but it is what we have learned from the pandemic. If you get this right, you can have an understanding of what's going to happen next. And if you do, similar to if you are facing a natural disaster like what happened with Hurricane Melissa, if you can predict and identify and prepare, you can mitigate some of the impacts that are going to happen. Just a reminder, Hurricane Melissa did hit Jamaica. It was a devastating Category 5 hurricane. Think of ways that you can support in any way you can. So let's get straight into the important points here. I'm looking at some key NHS statistics, and I suspect that this is likely to be occurring all across the world. So what I had done is that I looked through a number of years for September. So this is September 2023, looking at A&E attendances. Then you have September 2024, and then you have September 2025. I've then looked at all those statistics, pulled them together, and used it to help understand what I think is the extrapolation as to what is going to happen next. We can't always be absolutely clear, but if we can look at the patterns, we can make sense of it. So, what you have to realize is that pressure is building on the system. And there is no doubt this parliamentary report is showing, and I'll show you some of the points that it has highlighted. And you can see here, A&E attendances have increased over the past 15 years. And what they will be pointing at is the fact that this increase is a trend. But you have to remember there is a massive pandemic here. Hundreds of thousands of people died. You should see this should be a lower and then continuing to rise up. This, in my view, is an indication straight away that something is wrong. So whenever you look at the data, you have to always reflect on what I call a mortality debt, meaning that people are only able to die once. So if they have died already, so if you had older, sick people dying early in the pandemic because of COVID-19, you should therefore expect that there should be less people dying and, in theory, less pressure on the system. This is not what we're seeing. So then you have to ask why. Well, the natural answer will be COVID-19. That is certainly true. My point is, though, is that if you don't include elephants, and if you don't look at the patterns and compare it to different parts of the world, especially regions that have low vaccination rates, you are just kidding yourself. You're not actually looking at the science. So here is a quick breakdown of what I found. And this is just me, as I said, combining all the statistics and then putting it together in a way that makes sense to me. And I'll try and explain to you what I think is happening as we go through a few of these slides. So let's start with the trend year on year. And you can see here total attendances to accidental emergencies from 2023, 2024, 2025. And you can see even in 2023, the 2,166,000 was a 7.8 increase from 2022. So then when we look at 2024, it's still up 2.2 million. That's a 2% increase on 2023. And then in 2025, 2.3 million, a 4.3% increase on 2024. Now, there could be a number of factors for this, including people having more difficulty getting access to their doctors. And yes, that is likely to be part of it, as there are probably less GP appointments, and this is putting pressure on the system. But you have to look at it a little bit more detailed than that. And to some degree, that's correct. When we look at the statistics here, type 1 versus type 3 departments. Type 1 meaning your major accident and emergencies. Type 3 meaning your urgent care centers. And you can see that there in 2023, it had increased 5.2% from 2022. There was a 13% increase for the urgent care centers, which remained up by about 5% year on year for 2024 and 2025. Slight drop off for the type 1, which I tell you are the major accident and emergency departments, accidents, very sick people. Slight drop off in 2024, but then a continued rise in 2025. All of these things indicate that the population is not well. The question is why? Now, we break it down even further, and this is also very important. When we look at what happens in terms of emergency admissions, and you can see between 2023 and 2025, for one, in 2023, it was already a 7.1% increase from 2022. These are emergency admissions, and they're not gunshot wounds or car accidents. These are just people who are sick. So it's increased from 2022, continues to increase all the way to 2025, slightly less that increase, so it's slowing. That hopefully should be good news. But when we consider the fact that mortality has remained high all the way through, and this is what Andrew Bridgen in the UK lost his parliamentary seat over, because he was complaining about the fact that in excess deaths weren't being investigated. They came up with all kinds of reasons as to why they didn't need to investigate it, which is unbelievable. Why wouldn't you want to know if excess deaths are occurring, and why wouldn't you want to know why? It's the strangest pattern that I have noticed so far in the context of the pandemic. The last point in these slides that I wanted to make, and this is now the critical bit, which tells you what is happening on the hospital situation. And it's this 12-hour trolley waits, decision to admit admissions. What this means is that when we say decision to admit, meaning that if somebody is coming to hospital, they're unwell, the accident and emergency team think that they need a hospital admission, that's the time for the decision to admit. They're then referred on to whichever specialty is appropriate, and then they have to wait for a bed to become available. And so normally in the past, when there were 4-hour waiting times that have been completely crashed now, normally you would be trying to keep up to 95% of patients would have been moved on to their specialty within 4 hours from accident and emergency. And this was from prior to the pandemic. It was already difficult to achieve, but now it's virtually impossible. Now, when we look at these numbers again, you can see here delayed greater than 12 hours. I've highlighted this because this indicates patients who definitely you wanted to keep, because if they're already in the department for 12 hours, usually you try and discharge them. And so we can see year on year, this number is rising 20%, then 15%, 2024, 2025. This is indicating very serious pressure on hospital beds. And it's no surprise because a lot more people are sick. My approach to explaining this is tied down to the fact that you still have COVID circulating in highly vaccinated regions. It's the double whammy. You have to remember that in most situations where you have instituted vaccination, whether or not it's polio, it's measles, the majority of people don't get infected really. And so this therefore prevents circulation in the population and critically doesn't end up with a double immune response where you've had an immune response to the vaccination and then there are recurrent immune responses to every other infection. If you understand COVID as a vascular disease, where once it gets into the bloodstream, it creates all kind of havoc and damages the lining of the blood vessels, you will realize why I'm saying that if you have a population who already had immune priming of their immune system through vaccination, who then go on to be having recurring infection of COVID-19. Doesn't matter if it's mild, if that virus with the spike protein gets into the bloodstream, it's like a bullet bouncing around in a metal cage, so to speak. It does tremendous damage. And this, in my view, is why so many people are sick. It's very difficult to delineate the cause of the sickness because it is so hard to find. Most people don't even know if they've been exposed again. They just know they're feeling sick. They hadn't been testing. So therefore, they have no idea if it's another COVID infection. They've just got headaches. They feel fatigued. They oftentimes feel that for about 3 or 4 weeks. Then they will turn up in an emergency department completely unwell. And this is why, in my view, we are seeing this kind of picture. This is only going to rise. In 2026, it's going to probably be another 15 or 20% increase. That's the point that I was making. At what point is breaking point? And this is where you then see a massive surge in mortality. And how it works is that when departments are so full that the clinical staff are unable to easily identify and focus on the sick patients, that's when you have problems occurring in accident and emergency where people start to die. Because additionally, if you have sick patients who should have been managed on a ward with other clinical teams still getting unwell in emergency departments, how are they going to be able to focus on those people who have come in with the heart attack, the kidney failure, the severe lung infection? And when you put the two things together, mortality is likely to rise. What does it mean? Please don't get sick at this point, not seriously. And that's why, as I've pointed out before, I've been focusing on strategies to help you to stay well. Remember, good old-fashioned simple things, because everything now is about preventing infections. Don't forget, good old-fashioned humming heroes, teaching you all the principles that you need to know about the sinuses, reducing the risk of infection. There's a free black and white version of this. It's in the link and in the description. You can get it. You can learn about nitric oxide and how by simple strategies you can make a difference to your health and the health of your loved ones. I think that we're coming into very difficult times. I don't see any way out of it. And so the best that you can do is to prepare. It's very similar to what I think as I try and keep awareness and focus on the Hurricane Melissa that hit Jamaica. It sat outside the island for 5 days. It gave a chance to make some preparation, but there will never be enough preparation so that you can handle 175-mile-an-hour winds. But it gives you time to put things in place. In the same way, this information that I am giving you here is to prepare you for when that storm comes. When it appears, and a lot of people are sick, you don't want to be one of them. And that's the challenge. How to prevent and minimize and mitigate the risk of getting sick over the next few years. A huge challenge ahead. Thank you for listening. Look forward to sharing some more information in the near future.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.